my supplies here needed for the head to toe assessment exam, and we are going to pan the room to show that I have no materials, computers, or devices out before we get started. Hello there, my name is Brianna Lester. I am a DNP FNP student here to complete your head to toe assessment exam today, okay? Alrighty, could you start off by telling me your name and date of birth?
Angela Parker, July 25th, 1971.
Can you tell me the year?
2024.
Alright. So I did assess your gait as you walked in. You were well coordinated, no balance issues, and your gait was even. I did inspect her general appearance. She is well nourished. You maintain eye contact. You have good mood and good posture. So we are going to start off with our head and eye and neck exam. So I'm just going to start by inspecting your hair for any lesions or scalp tenderness anywhere. Come around this, okay? And inspect both sides. Your scalp is clean. I don't see any dry patches or lesions. I do see a birthmark back here as well. I'm going to take a look on this side of your ear. So what I'm going to do here is just palpate the side of your ear. Is there any tenderness there?
No.
Okay. What about when I palpate here on your tragus area? Any tenderness?
No.
Okay. I'm going to go to this side and we're going to do the exact same thing. I'm going to palpate here around the external ear. Any tenderness?
No.
Alrighty. And I palpate here on the outside of your tragus. Any tenderness?
No.
Alrighty, good. I'm just going to have a look here with my pen light just to take a look inside of your ear, okay? So I don't see any redness or discharge in your ear. I'm going to take a look at this side. No redness or discharge or skin lesions coming out of your ear, okay? I do just want to take a look. I do note that your nose is symmetrical. You do have great symmetry in your mouth as well. I can see no skin lesions on your face or on the outside below your jaw or anything. So I am going to get you just to close your eyes for me. Take a look at your eyelids. They look pretty symmetrical. I don't see any eye lag. You can open your eyes up for me. So I am going to test for your accommodation, and we're going to do some eye range of motions as well. So I do want you to start and just look straight ahead for me. I'm going to shine my pen light in your eye, okay? Alrighty, then we're going to do the other eye. Good, so I'm going to get you to look that way. Good, I'm going to get you to look the other way. Good. So your pupils are equal, round, and reactive, and they accommodate to light. When you looked at that wall, that's what I was assessing for, looking at the wall to making sure your pupils constricted, okay? So now what I want you to do is I want you to just follow my finger, okay? Just your eyes. Good. So I don't see any nystagmus or eye lag, and your eyes converge when I bring my finger closer to them, okay? Now I'm just going to take a look at your nose. As I stated before, I see symmetry on both sides of your nose. So I'm going to get you just tilt your head back a little bit for me, and I'm going to take a look at each nair. Good. I don't see any redness or swelling or drainage coming from your nose. So now what I am going to get you to do is we're going to assess your smell. So I do want you to cover one nostril, and I would like for you to tell me what you smell, okay?
Coffee.
Okay, we're going to repeat this on the other side as well.
Coffee.
Good. I am going to palpate your sinuses, so we're going to do your maxillary sinuses. Any tenderness or pressure?
No.
Okay. I'm going to take a look at your frontal. Any tenderness or pressure here?
No.
Okay, good. Now we're going to look at your mouth. I don't see any skin lesions on the outside of your mouth. I do just want you to open up for me, and I'm going to take my pen light and look to see your mucosa are pink. Do you mind sticking your tongue out for me? Pink tongue, no lesions noted on your tongue. Will you lift your tongue up for me so I can take a look at the underside? Don't see any abnormalities. I do want you to stick out your tongue, and when I get you to say ah, I would like for you to say ah, okay? You stick your tongue out and say ah. Good. I don't see any swelling of your tonsils or the uvula rises to the midline as expected, okay? So we are going to palpate your sinuses as well. I'm going to start here with your pre-auricular sinuses, post-auricular sinuses, submandibular sinuses, your submental sinuses. We have your occipital sinuses here. Good. Anterior cervical, excuse me. Posterior cervical sinuses, your supraclavicular sinuses here, and I don't note any mass or swelling or tenderness in your sinuses as well. So we are going to move on to the second portion of our head to toe assessment, where we're gonna listen to your lungs from front and back and your lateral sides, and I'm gonna take a listen to your heart, and we'll take a look at your reflexes in your arm, and we'll take a look and listen to your abdomen, okay? So I'm just gonna take a look and inspect your arms here. I don't see any lesions. I do see a tattoo here on this left wrist. I don't see any skin or lesions here on your arm as well. So now I am going to lift your shirt up here in the back, just so that way I can take a look, okay? I'll lift it up just a little bit. Alrighty. Don't know any lesions or swelling. I do see a tattoo here on your shoulder. I am going to take a listen. I will have to listen underneath your bra, so I won't get you to take it off, but I will place my stethoscope underneath it, okay?
Okay.
When I begin to listen, I do want you to take a deep breath whenever I ask you to take a deep breath, okay?
Okay.
All right. I'm gonna move your hair out of the way. All right. Deep breath in and out. Deep breath and out. Good. Deep breath and out. Deep breath and out. Deep breath and out. Good. Deep breath and out. And listen all down. I'm just going to lift up underneath your bra here. Deep breath and out. Deep breath and out. And I'll lift up underneath here. Deep breath and out. Deep breath and out. Good. Your lungs will clear to auscultation posteriorly. So we're going to move here and we're going to listen on the lateral side. So I'm just going to get you to lift your arm up here. And same thing as well, so that way I can get a good listen to your lungs. I will go up underneath your bra, okay? Deep breath and out. Deep breath and out. I'm going to lift up underneath here, okay? Deep breath and out. Deep breath and out. Alrighty, we're going to repeat the same thing on the other side. Get you to lift up this arm. Good. Deep breath and out. Deep breath. And out. Deep breath. And out. Deep breath. And out. Good. So lungs were clear to auscultation on both lateral sides of your lungs. So now I'm gonna pull your shirt back down because we don't need it up for this portion of the exam. I'm just going to take a listen to your lungs. I will lift it back up to listen to the front side when I get down here towards your stomach, okay? At this point, we'll get you to continue to deep breathe, okay? All right, take a deep breath on and out. Good. Deep breath and out. Deep breath and out. Good. Deep breath and out. Good. Deep breath and out. Deep breath and out. And I'm going to go a little bit deep, trying to keep the privacy maintained here. Deep breath and out. Good. And then on the other side, okay? Deep breath and out. Good. So like before, I'm just going to lift up and go underneath your bra here, okay? Deep breath and out. And then deep breath and out. Okay. And I'm going to do the same thing on this side. Lift up a little bit and out. And deep breath and out. Good. I'll lift your shirt right now. So your lungs were clear to auscultation anteriorly. Now I am going to take a listen to your heart with both sides of my stethoscope, okay? You can just breathe like normal during this portion, okay? And just relax and listen to your aortic valve, pulmonic, Erb's point, and go down again, kind of how I did earlier, okay? Tricuspid. And I'm gonna lift up here one more time. Alright, so I was able to hear S1 and S2 are present. I'm listening to your heart sound. So now I am gonna listen with the bell of my stethoscope to listen for any murmurs, okay? Listen to the aortic, pulmonic, Erb's point, and lift again like I did earlier. Tricuspid, and mitral. Okay, no worries noted when I listened to your heart sound. So S1 and S2 are still present. Now I am going to take a look at your carotid arteries. I'm just going to press on one side of your neck and listen for your carotid pulse. You have 2+ carotid arteries bilaterally. I am going to assess for your thyroid. So I am going to come behind you and I'm going to get you to flex your neck a little bit. I'm going to look for the cricoid cartilage. Then I'm going to get you to take a swallow. Good, and swallow again. So no masses noted or thyroid enlargement, okay? I'm gonna put this down for just 1 second. You're going to assess for your reflexes now. So we're going to start with your brachioradialis reflex. So I'm going to look for your bone prominence here. Good one. Alrighty, so brachioradialis reflex intact. And look for your brachial. I'm just going to get you a flex your arm up. Alrighty. You have your brachial reflex intact. So I am going to get you to just kind of relax this arm, and we're going to assess for your tricep reflex here. So I will hold your arm up, that way you can relax it. Alright, your triceps reflex is intact. I'm going to walk around this way, and we're going to repeat that on this side. So your brachioradialis reflex is intact. I'm going to do that same thing again on this side. I'm going to get you to bring your arm up. Good. Our brachial reflex is intact, like we did on this last arm. I want you to come up here. And your triceps reflex is intact as well. Now we're going to assess for sensation. So we're going to start with light touch. So I'm going to get you to close your eyes, and when you do feel me touch you, you can say now, okay?
Now. 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 Now.
Okay, sensation intact to light touch. We now are going to assess for your sharp and dull. So this is what sharp is, and this is what dull feels like. So when I ask you, you'll let me know if that's sharp or dull, okay?
Okay. Sharp. 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 Dull.
Okay, good. So intact, light, intact, sharp, and dull sensation remains. So we're gonna look. Assessing your capillary refill. It is less than 3 seconds. And nails and look smooth and round. I'm gonna get you to kind of make like a shape. Yep, like that. Yep, smooth and round. And I don't note any clubbing in your hands as well. So now I'm gonna get you, we're gonna do the abdomen, lower extremity portion of the exam. So I do want you to come and lay on the table for me. And move those out the way if we need to. Now I am just gonna lift your shirt a little bit and your pants just a little. So by taking a look, I do see that you've got some hair on your stomach here and a tattoo and a bruise and some birthmarks that we have here. Just taking a look. And I'm going to start by taking a listen to your lung sounds. Okay, you'll feel my stethoscope on your stomach. I'm just going to listen in all 4 quadrants. So I do note vowel sounds in all 4 quadrants. Now I'm just going to listen into your arteries in your stomach for any breweries. Listen over your right iliac artery, right renal artery, aortic artery, left renal artery, left iliac artery. I don't know any breweries in either of your both iliac arteries or renal arteries or your aortic arteries, okay? Now I am gonna assess now with light palpation. Please let me know if you have any tenderness, okay? It would just be my hand here. I'm not noting any masses or tenderness. Okay, so now we're going to do a deep palpation, okay? And you let me know. Don't feel any masses or tenderness. Good. I'm just gonna auscultate for tympani. Do you hear some tympani in the upper quadrants? Good. Good. And then I did palpate your inguinal lymph nodes. No tenderness or masses noted. I listened to your femoral arteries, and I did not hear any pruritus over your femoral arteries as well. Alrighty. So I am going to get you to sit up now, and you can swing your legs and just like sit on the table. Angle your legs off. So I do see some hair on your legs, not much for the most part. They are smooth. I don't see any varicose veins or anything like that as well. I don't know any ankle edema or pre-tibial edema. I am going to slip your sock off, okay? Both socks just for... And I see that your toes are smooth, pink, and round. And capillary refill is less than 3 seconds. Alrighty, and I'm going to feel your dorsalis pedis pulses. 2+ bilaterally. Posterior tibial. 2+ bilaterally. I'm going to feel your popliteal. 2+, excuse me. 2+ popliteal pulses as well. Now I'm going to get you to kind of press against my hands as hard as you can. Good. And press away like you're trying. Good. I'm going to get you to do the same thing with your arms. So I want you to press as hard as you can. You can put them in a fist in front of you. Push against me. Good. And pull like you're trying to pull to yourself. Good. So strength is 5 out of 5 in your arms and your leg reflexes. So now we're going to work on some more range of motion exercises. So I want you to flex your wrist up and down. Good. I'm going to show on the other side. And down. Then we're going to take a look and do the same thing with our feet. So flex them up, point them down. Flex that one up, and point them down. And now with our arms, so you're going to supinate this arm and then pronate your arm. Supinate and pronate. And we're going to do it with this arm as well. Yep, supinate, pronate. So see our range of motion is intact when you supinate and pronate. So then I want you to hold your hands out just like this, and you can do it one at a time. So we're going to do an ulnar deviation and a radial deviation. So you'll have to keep that wrist straight. So ulnar deviate, radial deviation. Good. We'll do it on this hand. Ulnar deviation, radial deviation. Okay. Then we're going to test for it in our feet. So you're going to evert your foot out and invert it in. Good. Try to keep that leg still and just try to use your ankle. So evert it out and invert it in. Good. I'll slip your socks back on really quick. Alrighty. And I'm going to get you to stand up, and you can hold on to the table as well. So now I'm going to get you to extend your foot forward, flex your leg forward, and then extend it backwards. Good. And then flex your foot forward, extend it backwards. So I'm going to get you to abduct. So that means to take your leg away from the midline. So you'll shoot that leg out. Good. And you'll do it for the other side. You can turn around if you need to. So that way you don't hit your leg. Good. You can turn and face me again. So then you're going to get you to adduct. So that means adding it to the midline. So you'll cross that leg over in front of you. Good. And the other leg. Good. So we're gonna assess your internal and external rotation. So you'll, oh Jesus. So you'll externally rotate it out and externally rotate it in, and then externally rotate it out. All right, so our range of motion is intact for all range of motion activities. For the next portion of the exam, I would wash my hands again and have a chaperone present and don gloves. So for the breast exam, I would have my patient here to lay back on the table, and I will assess her breasts for any abnormalities, masses. I'll look at puckering of the areola, any discharge or redness. Then I will palpate her breasts in a circular motion and palpating up to the tail of Spence and palpating the axillary lymph nodes and the supraclavicular lymph nodes as well. For the genitalia exam for the woman, I will assess the vaginal and the vulva for any redness or discharge. Then I will take a look at the labia for any redness, swelling, or discharge, and assessing the hair distribution for any piercings as well. Then I will insert or palpate the Bartholin glands to look for any masses or tenderness. For the male genitalia exam, I will take a look for any pureness, any swelling of the urethra, redness, or discharge. I will palpate the testes for any masses. Then I will check for the chromatic reflex, and I will use the other side of my reflex hammer and stroke down the inner thigh, and one testes should rise, and repeat it on the other side. For the rectal exam, I would have my patient turn their toes inward and bend over, and then I would insert one lubricated finger to palpate for any tenderness or masses and around the prostate gland. Thank you. This is my head to toe assessment.